Kittens, like all young animals, are particularly vulnerable to a variety of diseases due to their still developing immune systems. Early detection and prompt action are crucial in safeguarding their health. Understanding the most common diseases in kittens, recognizing their symptoms, and taking preventative measures can make a significant difference in their well-being. Upper respiratory infections are among the most common ailments affecting kittens. These infections, often caused by viruses like feline herpesvirus and feline calicivirus, are highly contagious. Symptoms include sneezing, nasal discharge, watery eyes, and loss of appetite. In severe cases, kittens may become lethargic or have difficulty breathing. Keeping your kitten's environment clean, minimizing stress, and vaccinating against these viruses are effective preventative measures. If your kitten shows symptoms, isolating them from other cats and seeking veterinary care is essential. Feline panleukopenia, also known as feline distemper, is a life-threatening viral disease that primarily affects kittens. This highly contagious virus attacks rapidly dividing cells, leading to symptoms such as vomiting, diarrhea, fever, and severe dehydration. Vaccination is the best defense against panleukopenia, as it provides strong immunity. Prompt veterinary treatment, including fluid therapy and supportive care, is critical for affected kittens. Another common concern is intestinal parasites, such as roundworms, hookworms, and tapeworms. Kittens often contract these parasites from their mother or through their environment. Signs include a pot-bellied appearance, diarrhea, vomiting, and poor weight gain. Regular deworming treatments, starting when the kitten is 2 to 3 weeks old, can effectively prevent and treat infestations. Maintaining good hygiene by cleaning the litter box frequently and preventing your kitten from eating raw or contaminated food can also help reduce the risk. Feline leukemia virus is a serious illness that suppresses the immune system and can lead to secondary infections, anemia, or cancer. Kittens are particularly susceptible if exposed to infected cats. Symptoms may include weight loss, fever, pale gums, and lethargy. Testing for FALV is important, especially if your kitten will have contact with other cats. Vaccination and keeping your kitten indoors to limit exposure to infected cats are key preventive strategies. Another viral disease that affects kittens is feline infectious peritonitis. This condition is caused by a mutation of the feline coronavirus and is often fatal. Symptoms can vary but typically include fever, weight loss, abdominal swelling, and difficulty breathing. Feline infectious peritonitis is more common in multi-cat environments. While there is no definitive treatment, early diagnosis and supportive care can improve quality of life. Reducing stress and maintaining good hygiene can help minimize the risk of feline infectious peritonitis in kittens. Ear mites are another common issue for kittens, especially those coming from shelters or outdoor environments. These tiny parasites cause intense itching, leading to excessive scratching, head shaking, and dark discharge in the ears. If untreated, ear mites can cause secondary infections or damage to the ear canal. Regular ear cleaning and veterinary recommended treatments can quickly eliminate ear mites and alleviate discomfort. Kittens are also prone to ringworm, a fungal infection that affects the skin, fur, and nails. Ringworm appears as circular, scaly patches of hair loss and can spread to humans and other animals. Treatment typically involves antifungal medications and medicated shampoos. Keeping your kitten's environment clean and isolating them from infected animals can help prevent the spread of ringworm. Dental health issues, such as gingivitis and stomatitis, can also occur in kittens, particularly those with underlying viral infections. Symptoms include red or swollen gums, drooling, and difficulty eating. Starting a dental care routine early, such as brushing your kitten's teeth with pet-safe toothpaste, can prevent these problems. Regular vet checkups will also ensure any dental issues are addressed promptly. Lastly, behavioral changes such as lethargy, aggression, or hiding can sometimes indicate underlying health problems. These changes are often subtle but should not be ignored, as they may signal pain, discomfort, or illness. Observing your kitten closely and consulting a veterinarian at the first sign of unusual behavior is critical for early diagnosis and treatment. Prevention is always better than cure. Vaccinations, regular deworming, a balanced diet, and a clean, stress-free environment are the cornerstones of good kitten health. Establishing a relationship with a trusted veterinarian and scheduling regular checkups will ensure that your kitten grows into a healthy and happy adult cat. As a cat owner, staying informed about common diseases and their prevention will empower you to provide the best care possible for your furry friend.